Welcome to Asia Healthcare 2021.
Good morning, and thank you to all of you for being with us today. How are we doing in this market? This is what we're going to talk about this morning.
What has happened is that in the last year and a half or around that time, what we see is that the healthcare has actually come to the forefront.
What impact has COVID had on this pre-existing trend?
I think it has multiple dimensions to that. In the last several years, I see that the patient's voice has been becoming more important.
$1,000,000 question. I've seen tremendous delays in the clinical development of other drugs.
If you look at the money that's been poured into vaccines, a lot of it is actually funded by government.
I really hope that the way this COVID situation, drives the clinical trial to be faster. It will be more preventive healthcare type than reactive.
I mean, as you said, COVID basically forced that, right? So there was a shift to, digital. Healthcare, I think, was a bit slower compared to other industries.
What, in their view, are the 2 or 3 most important healthcare needs in Asia?
Access to healthcare for the population is very reduced. They're all concentrated in urban centers, highly dense.
Healthcare systems all over the world have not been coping for the longest time.
When we look at the challenges for healthcare, from my perspective, I think quality of care and cost of care is going to continue to drive innovation. So affordability remains one of the biggest issues.
We saw that when the vaccinations became available, the frontline healthcare personnel were being prioritized. Now, Leonora, did the supply chain industry also lobby towards getting vaccinated first, considering that ensuring an uninterrupted supply chain involved personnel remaining healthy themselves?
Yes, that's a good question.
Has the healthcare supply chain industry transited from just-in-time to just-in-case?
Each country will have its own vaccination rules, vaccination prioritization. If you're working in operations, where you have to, deal with the cargo, you have to deal with groups of people, then I think if it's considered essential services, you're at the front line, then it makes sense to be vaccinated first.
One of the key things we've been looking at in Hong Kong has always been the packaging, because if anybody can get hold of the packaging, they could potentially put their own fake vaccines into the original packaging and make it look very good.
We've heard just 2 days ago that there was a cluster infection in Tan Tock Seng Hospital, despite the staff being vaccinated already. So it looks like COVID-19 is not going to go away anytime soon.
The government has led a major initiative to equip our hospitals with capacity for handling pandemic. But unfortunately, when it comes to COVID-19, the scale and ferocity of this COVID-19 is really beyond what we could imagine.
Every pandemic is different. The big difference for COVID, this is a highly transmissible disease.
Over in Vietnam, what was your experience in Vietnam?
I've been in Vietnam since the last Chinese New Year holiday, and I've not been able to go anywhere except in Vietnam. However, the pandemic in Vietnam is very well under control. The first step the government did was to lock down the border. It is one of the first countries to actually stop all international flights when the pandemic started sometime early last year.
On that note, we look forward to seeing you again next year, and in the meantime, stay safe, stay healthy, and goodbye.